afternoon. This is Dr. Famuyiwa again from Montgomery Fertility Center. So we're going to continue our IVF series. We're going to talk about when do you need IVF or when do you need in vitro fertilization. In vitro fertilization is usually employed when you are having difficulty conceiving naturally or you haven't been successful with some other less invasive means. So sometimes we would recommend in vitro fertilization when patients have failed intrauterine insemination cycles or they have unexplained infertility. That can be an indication for IVF. For patients with advanced maternal age, if we're worried about rapidly declining egg quality and quantity, that also may be another indication to proceed with IVF. There are some patients who may have ovulatory disorders, simply meaning they're not ovulating on a regular basis. If they're not ovulating regularly or consistently, they may have difficulty conceiving. So those patients may actually need in vitro fertilization. There are patients who may have endometriosis. Endometriosis, if you look at my other post on YouTube, is a very inflammatory condition that can induce scarring and can cause blockage of the fallopian tube. It can also affect the uterus as well. Sometimes those patients may need to consider in vitro fertilization. Other times that you may need in vitro fertilization include when we have a male factor, such as insufficient sperm or lack of sperm that may need to be collected from the testicles. So those patients may actually need in vitro fertilization to conceive. Now, there are some couples that may have genetic disorders that may be transmitted to their offspring. Such disorders may be debilitating, and they may use in vitro fertilization to avoid transmission of such a disorder to their offspring, such as Tay-Sachs, for instance. Other instances include couples who may want to preserve their fertility. They're not quite ready to have children yet, but they want to start accumulating embryos for storage. In those cases, those patients may also consider in vitro fertilization. So I hope this has answered some of the when questions, and please continue to follow us as we continue our series. Thank you very much.